Hey everybody, this is my lung issues video. Fair warning, I'm not a lung expert, so I can only really speak on things that basically I've had and do have knowledge on. So you might not learn everything here, but I do know a lung expert that we've done a video with cystic fibrosis, and I'm sure if you have any other questions, she would be happy to help. So let's just get started with asthma. Asthma is something that typically starts as a child, and a lot of times you grow out of it as you get older. You know, you grow out of lots of different type of illnesses, and asthma is one of them. Not always, but typically. You can have exercise-induced asthma, meaning that you only get short of breath and, you know, tight-chested and that type of thing when you're at exertion or when you're physically moving around, or you could have asthma flares at rest. And I actually have both. I can just sit here and all of a sudden can't breathe. Along with that goes flares, or I can't think of the other word for it, but basically when you cannot breathe at all for a lengthy period of time. Typically when that happens, you have to get some type of intervention. I've had to go to the ER before and get a bunch of tests run and all of that, only to come out with prednisone. Prednisone doesn't work for everybody, for everything, but to me, and a lot of people that I know, prednisone is like a miracle drug. Basically, it takes those inflammation symptoms and just like gets rid of it within, I don't know, usually 2 to 4 days has been my experience. So prednisone is amazing. Also, with asthma, you get thrush. Well, you don't, everybody doesn't get it, but if you have inhaled corticosteroids, okay, so there's probably more different types, but I have here 3 different types of inhalers, okay? So we have Pro Air, which is as needed. So that's the one that you use when you feel all of a sudden out of nowhere that you can't breathe. That's the one that you're going to use. Then you have maintenance inhalers. This is Spiriva. It is not a corticosteroid, so this one doesn't bother me at all. No symptoms whatsoever. And then you have inhaled corticosteroids. I've been on just about every one that they have, and just about every one has given me thrush to some degree. This one took a while to give me thrush, but we have it now. This is a spacer. So basically, instead of just inhaling straight from the mouthpiece, like on this, it has to travel this distance in order to get to your mouth. Therefore, it should reduce the likelihood of thrush and the bad taste in your mouth and all of that that comes along with it. But it didn't really help with me. So after you use especially a corticosteroid, you're supposed to rinse your mouth out. There's different schools of thought when it comes to that, though. Do you brush your teeth before or after you use that? Do you use mouthwash with alcohol or not alcohol? Do you rinse with water, salt water? Like, there's so many schools of thought. I don't really know who is right. But when you get thrush in your mouth, a lot of people, when they hear the name thrush, they think of babies, because babies often get it. However, it's not something that only babies can have. It is not abnormal to have it when you have inhaled corticosteroids, okay? So I'm going to show you my tongue right now. If you get weirded out, you know, just come back in a few minutes. Mine isn't terrible as of right now, however, it is active, okay? So it has been more white than that. I've been using some stuff to calm it down some. It has been bleeding, not just out of the blue, plus when I brush my teeth or anything like that, it's been bleeding. And I have sores. I think that I only have like one that's really bothering me, and I don't know that you can see it still. I don't know if you can still see it, but it's very painful. So it's basically having a yeast infection in your mouth, and it tastes weird. It can hurt. It gives you white tongue. Sometimes it gives you bad breath. Your tongue can bleed. You can have sores on your gums, your cheeks, your tongue, roof of your mouth, you know, all of that. And it's not pleasant. So the things that after you do get thrush, which hopefully you don't, but if you're like me, you do. Some things that you can do. This is nystatin. So basically that is a antifungal, okay? So when you use this, most of the time you spit, you rinse vigorously for however long it tells you to, and then you spit. Some of them tell you to swallow, because if you're inhaling it, it does go down that same tract. So some of them do tell you to swallow. However, I don't get any benefit out of that pretty much whatsoever, other than a really nasty taste that doesn't go away for a really long time. So actually one of my dentists told me about it the first time, and I've just been a huge proponent for it ever since. And this one is Magic Mouthwash, okay? And most people have never heard of it unless you work in a doctor's office or a pharmacy, or if you've had it. What it is there's several different recipes, but the most common one is lidocaine, which is, you know, the one that takes away the pain and gives you a numbing sensation, and usually something to the lines of Maalox to coat. They could also use like Carafate, and usually it has a nystatin or something comparable to nystatin. So I called the other day because it was really bad, and my lung doctor just sent nystatin after I explicitly asked for Magic Mouthwash because it's magic. So I had to end up calling my PCP to get the Magic Mouthwash because it was hurting. Like, I needed the lidocaine because the lung doctor said, oh, well, use Listerine. My mouth hurts. You know, after I can get it calmed down, then we can talk about alcohol-based mouthwash. But at the moment, my tongue hurts. So, you know, right now, I'm using Magic Mouthwash. Again, it says swish vigorously for however long. And typically it tells you to spit, but it doesn't always. I like to swallow it because, again, it goes down the same tract and it has that numbing and coating effect, and also gets the nystatin down there, antifungal down there, in case you have inhaled that, which you most likely have if you're having issues in your mouth, right? So, let's talk about sleep apnea. I've gone to a sleep doctor 2 different times. I've done sleep testing, and it's different depending on what you're doing it for. For example, the first time I did it, we were more focused on narcolepsy, which is, you know, when you fall asleep driving and stuff like that. So that centered more along the lines of, I slept, well, they hook you up. I posted a picture just the other day. Hook you up with all this garb. You sleep at night. It monitors all of this different stuff, and you wake up in the morning. Typically, you go home after that. However, for the narcolepsy one, you do not, because they keep you several hours after you've woken up you are able to take a nap. However, the length of your nap is based on how quickly you go into REM sleep. So for me, it was like 30 seconds. So I got less than a 5-minute nap. So if you don't go into REM quickly, then obviously you're going to have a longer nap. So for my second, I had breathing obstruction issues. That's why we were doing it. So it was a completely different focus. They still hooked you up to all the garb, and you slept overnight, and then you went home in the morning. But they were more focused on, did I need a CPAP? How was I? You know, because I had had a pulse ox that I had stopped breathing several times, and they were worried about that. They wanted to track that to see if I needed intervention. I was borderline, thankfully, but when you do have sleep apnea, like my mom has a CPAP, it's this contraption that looks, it's probably a little bit bigger than a nebulizer, and it has all these hoses and stuff. You put it, there's different ways to do it, under your nose, in your mouth, full facial, and you wear it all night. So I wore it one night and it sucked, but maybe that's because I really didn't truly need it. She loves it. When she doesn't use it, she wakes up and feels like she's never been asleep because she's still exhausted. And, you know, sleep apnea can have a bunch of different negative side effects, you know, weight gain, memory issues, gastric acid reflux. I know there's a lot more. I just can't think of them off the top of my head. But if you're having issues, you know, in that realm, anywhere in that realm, it is definitely worth getting checked out. A friend of mine, her kid is actually going to have one because they're worried about adenoids. Not necessarily tonsils, but adenoids. So that will probably be a little bit different because they're focusing on something different. She is also a mouth sleeper. She sleeps with her mouth wide open pretty much all the time. So there is several different what am I thinking of? Reasons, I guess, on why to do some type of sleep study, but a lot of it is breathing. Okay. Pneumothorax. I've not had one, thankfully, but it is very common in connective tissue disorders to have a pneumothorax, and what that is a collapsed lung. You've probably seen it, or if you watch Grey's Anatomy or, you know, any of those, you've seen them put a chest tube in for a collapsed lung. Lots of different reasons that they can have a collapsed lung, but typically on TV, it's usually some type of injury, and it's collapsed the lung. So they put a tube in to release the pressure on the lung, if that makes sense. Costochondritis is not necessarily breathing, but it is affected by breathing. So basically, costochondritis means inflammation of the lining between your ribs. So costo is rib, and itis, inflammation. Chondro is I can't think of the word right now, but yeah. So that is very, very painful. You typically don't know what's going on because your chest just really, really hurts and it feels really, really tight. So basically they rule that out with a x-ray. If you have that, it's not something that goes away immediately, that like with treatment or anything like that, but it is something that can be affected by a breathing disorder, such as bronchitis. You know, I've had bronchitis. There's a difference between acute and chronic, pretty much with any type of illness that you talk about. But, you know, in this example, we're talking about bronchitis. So acute means that it's a quick onset. It's not been happening very long, and it's, you know, pretty severe usually. As opposed to chronic, That means it's long term. It's been happening for a while. It's pretty steady in the progression. Of course, you're going to have flares or things like that, but that's the difference between acute and chronic. So when you see that on your paperwork, that's what it means. Bronchitis is the inflammation of your bronchial tube. And even if you don't have it chronically, I would be willing to guess that most people have had it at least once in their life, because it is fairly common to have it acutely, usually during flu season. And typically it is accompanied with shortness of breath, chest tightness, and this really deep cough that sounds like a seal barking. At least that's what everybody in school called it when I coughed, because where I have chronic, when I cough, it is like that instead of that doesn't do anything for me. I have to actually cough. So there is medicine for that. It's an inflammation, so you know you're wanting to treat the inflammation. Cystic fibrosis, I do not have. However, I have done a live video with Megan, who does have cystic fibrosis. So if you're interested in that, please refer to that video, or we can ask her questions. Then we're going to talk about sinus problems. And sinus problems can affect your breathing, obviously, because your sinuses, you know, you have different places, your frontal and your da-da-da-da-da, and each of those can be affected differently. They're sacs of air, right? So when I had my wisdom teeth cut out, I never had issues with sinuses until then. My bottom ones were impacted into my jaws, the top ones were impacted into my sinus cavities, and after that I had issues with all of it. So what usually, again, you know, when we're talking about allergies is typically when you have sinus problems flare up. And a lot of times you'll have pressure right here, and right here is usually the main points. It just sometimes feels like your head is floating. You get a headache, obviously. A lot of times it's behind the eyes, drainage, you know. So when you're talking about sinuses, I had a sinus CT because they were checking out my tinnitus. If you remember back then, tinnitus is ringing in the ear. So what does ringing in the ear have to do with sinuses? ENT, ear, nose, and throat, are all connected. It's all just, you know, intertwined in there. So they did a sinus CT. What that sinus CT showed was a septal deviation to the right. So what that means is your septum is the thing inside your nose, separates the two cavities, okay? Instead of being like this, mine is like this. So what that means is, in layman terms, my left nostril is much bigger than my right one. For the most part, it doesn't cause me any issues unless I'm having congestion and that type of thing. And I also had pretty large polyps. Polyps can be pretty much anywhere in your body. I've had them in my colon. I've had them in my ureters, which is what connects your kidney to your bladder. Sometimes they can be cancerous or malignant, or most often they're benign and not cancerous. So these, we didn't biopsy them, but I'm assuming they're not cancer. So the doctor wanted to do removal of all of this and fix this and do that. Well, I went and got a second opinion because that's a lot of work. And when you look in the big Marfan group, a lot of people have had that surgery and need it again and again because our tissues suck. And just because you fix something one time doesn't mean that it's going to stay like that forever. So for me, when I went to the second opinion, I said, you know, what's the likelihood that this isn't going to happen again? And she said, you know, with Marfan's, there's no guarantee. And really, I don't want to do surgery unless it's actually bothering you constantly. And it isn't. So right now, we're just monitoring it. And I'm cool with that. I did want to show you my nebulizer. I'm sure you've seen a nebulizer, but in case you haven't, this thing right here, okay, so you have this tubing that connects it to here. This is your mouthpiece that you're going to be blowing in and out of. And this is the reservoir, which holds liquid. And that liquid, hang on. Sorry. That liquid is, you know, whatever your doctor prescribes that you need to be inhaling. However, most of the time it is albuterol. So you open up this little thing, put it in the reservoir, and different from the inhalers are a strong burst all at once, whereas the nebulizer takes 10 or 15 minutes to deliver it slowly, and you're able to breathe naturally. You don't have to hold your breath and, you know, all that stuff that you have to do with an inhaler. You just have to breathe normally. Okay, so most of the time you at least get albuterol, which is the same thing that's in that Pro Air. I have budesonide too. They have that added for my asthma, you know, because there's like a million different drugs for asthma. I did too want to show you how to properly use an inhaler. And I know this is very odd for everybody that has used one, but you would be very surprised at the number of people that use them wrong or aren't taught how to use them. Or you know, I've heard people say, oh, okay, well, yeah, you put the air in there and swallow it. Well, not really. I mean, I've also had people do it, and then when they think that they're holding their breath, their mouth is open, so that stuff is coming out of your mouth, okay? So you obviously want to make sure it's in date, depending on the inhaler, depending on how they work. Like, for instance, this one is a twist and a pump, okay? But for the typical Pro Air, typically in a canister, okay? So you always want to shake it, put it in your mouth, hit this, that dispenses the mist, and hold your breath, okay? And you blow out first. So basically, you're trying to take a deep breath and hold it as long as you can in order to get the most effect out of that. And I know for most of you that know how to use it, that is very tedious of me teaching how to do that, but you would be very surprised on the amount of people I've had to do videos for or teach them in person, because they just, you know, if you don't know, if you weren't taught that, and if you don't do that, you just don't know. It's kind of like putting in contacts. If I do it right now, you know, most of you that's worn contacts would think, oh, that's silly. But when I worked in an eye doctor's office, I had to teach people how to put in contacts all the time, like at least once, twice a day. So it's kind of the same thing. Like, if you don't know, you don't know. So I'm sure I've probably missed some things on here. If you have questions, obviously let me know. If you would like a more detailed, you know, from somebody that has had way more lung problems, we can probably do that too. We can at least ask. You can also refer back to the live video that I did with Megan on cystic fibrosis. She is very informative. She has had a double lung transplant and dealt with breathing issues her whole life. So she is very, very knowledgeable on that, okay? So I'm hoping that this helped at least someone. And let me know if you have any questions. Thanks for being here.